Hello and welcome back to the Patient First podcast. I am going today to discuss a specific issue that I believe many people may be thinking about, that might be on your mind. You might be questioning yourself because we in dentistry, and frankly, all employers across the world, frankly, have been through the ringer. There's been an exodus of employees, particularly through dentistry, as we've been talking a lot about on this podcast. I know it's on a lot of our minds. And so this is not just a dental issue. However, I believe that what's going on in the workplace has affected dentistry much more than most other industries. And so I'm going to start by asking you a simple question. And that question is, are you worried your office manager is looking for a new job? Now, I think, frankly, if you're worried about it, you probably should be, because 50% of team members in our practices are looking for jobs in other practices. And that's after the exodus from the profession altogether. And obviously, I think the reason why I focused in on the office manager is that they are usually the keystone of our practice. Now, it doesn't necessarily need to be the office manager that I'm talking about today. Maybe you have a phenomenal assistant who is just a leader in the practice, who manages people, and you get this sense that they might be ready to go. The problem is, you are very well right if that's the case, because if half the people in the industry are looking for jobs, chances are you've got some in your team too. So if you've been coasting, assuming that your team will be fine and stick around, and that 50% is for other practices. I talk to dentists all the time, and I can tell you right now, everybody feels that way. Everybody feels that way, right? So that's the bad news. And I think, so it really warrants a follow-up question. And that follow-up question is, what happened the last time that somebody bolted? When somebody left your practice, how did you feel? Did you freak out? Did you think that person is irreplaceable? I don't know how Susie or Steve that left, how I'll ever find a replacement, right? Did you scramble to put an ad online, go and be sort of very, very reactive and react to the fact that you just lost somebody? And how did that work out? Well, probably isn't working as well today when there's less people. It's people are looking for higher wages. So, I think really think about what happened the last time you lost somebody, particularly somebody that you thought was really key asset to your practice, and what would happen to your practice today if that person that you're thinking of right now, if he or she left. Would you freak out? Would you not know what to do? Well, I think that we in dentistry prior to the pandemic should have been on top of that issue, and we weren't. And that's probably why we've had a larger exodus of employees in the average profession, and why half our team members are looking for jobs elsewhere, because the grass is always greener on the other side, right? So let's get into 3 steps to get ahead of this, to be proactive, to actually get ahead of this, if not today, so you can set yourself up in the future for success, and start recruiting the right people that are going to be soldiers for your practice. And Darren Hardy, who's a mentor of mine, he always says you want soldiers, not mercenaries. And you probably got that from somebody else too, but I think that's true. Like, if you think that pay is going to do the trick, you're wrong. We've talked about it on this podcast before. The teams, the companies that have great people, they're not going to be underpaying people, but they're usually maybe average or maybe slightly above average. They're not paying people more. They're just better at attracting and retaining the best people. So let's get into it. What are the 3 steps that you can do to be proactive, so that if you have a key person leave, first of all, that they don't leave, but then if they do leave, how you have a bench of people waiting to work for your practice. Number one, and this is very key. I don't want to minimize this because it gets glossed over. It's mentioned a lot, and it might be a little overspoken about in sort of business guru-y terms, but it's vitally important, is to decide what your practice is about. So if somebody comes up to you and says, what makes your practice different from another practice? And you can't tell them in a way that a fourth grader could tell, boy, this is what that practice is, how this practice is different than an average practice. Why would anybody want to work there? Why would anybody want to go there? Because you're just like everybody else. Yeah, and I don't believe that in dentistry our competition is other practices. I truly don't. I think that our competition is soda. It's people spending money on things that they want that they don't need. And oftentimes, dentistry feels more like a want than a need when we all know that oral health is the gateway to of your overall health. So I think that is key for us to not view other dentists as competition. I think that we as an industry have been undervaluing our services for too long. And that means that the dentist next door isn't your competition. However, any business, any organization that wants to attract great people to it has to stand for something. You have to have a vision of where you're going. That vision is what's going to get people who are good come and stay with you because people want to work for a business with a purpose. What is your purpose? And frankly, I don't even think it matters what that purpose is, just that you're clear about it. So, number one is to get clear about what your purpose is, why your practice is different, and make it as simple as possible. If you can say it in 3 words, great. If you can say it in 3 bullet points, but you should be able to know it, you memorize it, reading it once, because if you can't, nobody else is going to. Your team member that you just hired that's worried about fitting in with your team and all that is not going to know what this place stands about. They might understand it when you tell them, but then they'll forget it the next day. This has to be very, very simple. Now, obviously, pay has to be there. You have to have, good pay today. Today that's very challenging, so I don't want to minimize finding what the right pay is, but along with pay, as important is a simple, clear purpose. So that's number one. Number two, decide equally important what your practice is not about. Many, many, many times we're more motivated by what we don't want to do than what we do want to do. And I'll tell kind of the extreme example of this from my life is with my accountability partners. I get together with 2 guys every week and we talk about what our goals were for the week and if we met our goals, if we didn't make our goals, and then we meet quarterly and annually. So for me, accountability is a very big deal. Um, and so I have 2 good friends that I do that with. And if we really want to do something, so let's say I want to, like right now, I want to lose some weight. So if I really was serious about it, which I'm not quite there yet, but I'm getting there. But if I was really serious about it, and I said, I want to lose 10 pounds. What do I do with my accountability partners? Well, I take out my checkbook and I write a uncomfortably large check to a cause that I hate. So think about a political, obviously it's very easy right now in the political environment to think about whichever side you are against and think of the worst person on that you would want to write a check for. And then think of an uncomfortable size that for you, you go, I could not imagine giving that party, that person, that cause, maybe it's, an organization that clubs baby seals, something horrible. Write a check that's uncomfortably large for that, and then you give it to your accountability partner. And you say, if I don't lose 10 pounds by that date, mail this check with the stamp on the envelope. That, my friends, is very motivational. More motivational than if I had written that check for a cause that I enjoy. Because it's going to a cause, good cause. I'll just eat this cake or I'll drink this second beer, right? But it's more motivational to not do things that you don't want to do. So, as equally as important, what you stand for is what you stand against. And that can be anything. Again, it can be against, we don't like doing oral surgery in this practice because there's going to be assistants and hygienists that just, they're queasy about blood, right? So that's not for your practice. Or it could be that we don't tolerate any type of intolerance in our practice or whatever it is that you truly stand for. You'll attract people both by what you stand for and then what you stand against. And it could be, you are against products that are poor for the environment. So you're pro environment and against things that are wasteful and whatever that is, however you want to message it. Now, I hope you understand the power of standing against something that is you believe to be philosophically wrong, or just something that you want to avoid at all costs, and be clear about those two. It can be simpler, the things that you want to avoid. It can be something just like we don't do surgery here, or it could be, we don't do things the old-fashioned way. We are about technology, and we're not about waste here. We are about automation. We don't want people at our front desk at our business who are running the businesses of our practices. We don't want them wasting their time fielding phone calls that are unnecessary or paperwork for sure. If we can do text to pay or email pay or send people directly to your website to pay, why would we have them sitting there processing paperwork all day long. We stand against that. We want our people to be talking to other people because we are a human focused practice. I'm just spitballing here, but you get the idea what we're against and what we're for. And then thirdly, and most importantly, once you're clear about what you are for and what you are against, repeat it all the time. Simple, clear messages that you repeat all the time until you think you're harassing your employees, not harassing them, but bugging them about what you're for and what you're against. They should know that to a T, and that when they come to the office, they know exactly what the mission is, what you're fighting against, what you stand for, and then externalize that as clearly as you can to the outside of your practice, and you will attract the right people who are down for your mission, who are willing to fight against or willing to be soldiers against the things you stand against, and externalize that to the dental schools, to the hygiene schools, to the assisting schools, to the in your local dental magazines. So make sure to repeat it all often and always so that everybody knows what you stand for and what you're against. And then pay and everything else becomes secondary. Because if you are clear about your mission, what you're doing, and what you're against, and it's not generic. So this can't be, we do cosmetic dentistry. Every dentist thinks they do cosmetic dentistry. What exactly makes you different when you do cosmetic dentistry? We take the most hours in CE, or we take the most time with our patients. Whatever it is that makes you feel good about coming to work every day and doing what you do is going to attract other people that will feel good coming to work for you to do what they do. So it's kind of a big picture today, but I think it's very important. It's a simple, clear message that I think we in our practices need to have a rallying cry about what we are for and what we are against to be able to retain, attract, and hire the best people so that we can have thriving practices. Because obviously, having great people is the key to having a great practice. You want to learn more? We talk a lot about sort of positioning your practice to, and frankly, a lot more systematically hiring, firing, selecting the right people in the Insanely Productive Dentist, or many courses that we have now at upgradedental.com. In fact, we're bringing on great faculty members, Dr. Chris Phelps, Abby Fry, Allison LaCourcier, and Dr. Peggy Brown, and Dr. Kelly Tanner. We've got some great courses coming. So if you haven't been to upgradedental.com recently, go there now. There's a bunch of free courses every month that we have available for you. And we're building this community that just started less than a year ago. And we already have 5,000 members. Thank you, everybody. We're over 5,000 now. And, I love the comments that I'm getting from people. So make sure to comment, like, subscribe below this video. And if you want to watch the videos now without any ads, if you want to go straight to the videos, not just my videos, but all of our faculty members have their podcasts, have their videos posted on upgradedental.com. So it's becoming a hub for the place to find how to grow your practice by putting patients first, because we all know that putting the patient first is the new way to build the practice of your dreams. Thank you very much, and I look forward to seeing you next week on the Patient First Podcast.